Now the next condition is also seen in smokers. It is known as Rinke's edema. Rinke's edema, as the name suggests, it is also known as the smoker's polyp. Now what is the etiology? First of all, it is the people who smoke, and then it is also the chronic sinusitis. Chronic sinusitis, it leads to the postnasal drip, which can also cause the Rinke's edema. And apart from that, the gastroesophageal reflux disease, that is the reflux of the acid from the stomach, it can also cause Rinke's edema. And mixed edema is also one of the known etiological factor for the Rinke's edema. Now if you see carefully in this diagram, it shows an epithelium. This is the epithelium. This is the epithelium, and this epithelium basically it is lined by not the pseudostratified ciliated columnar as in the rest of the larynx. It is basically the stratified squamous epithelium, and just beneath the epithelium and between the vocalis muscle, you will see a potential space. This space it is known as the Rinke's space. So between the epithelium and the intermediate and deep lamina propria, which forms a vocal ligament. So between the epithelium and the intermediate and deep part of the vocal ligament, you will have a potential space which is known as the Rinke's space, and vocal ligament it is formed by the intermediate and the deep layer of the lamina propria. So it is formed by the intermediate and the deep part of the lamina propria, the vocal ligament, and this is of course the vocalis muscle. Now if you see this condition, it presents to us, as I said, the patient will be having a husky voice, and it is typically seen in smokers, and on examination what we will see is a bilateral diffuse swelling. So it is not a unilateral condition like vocal nodules, it is also a bilateral diffuse symmetrical swelling. It is a symmetrical pale swelling like here, like you can see here. So it is a bilateral pale diffuse symmetrical swelling which is seen along the two vocal cords. So this is known as the Rinke's edema. Now what are the clinical features? If you can see the vocal cords, they are basically become heavy, they have become swollen. You will see a low pitched voice, that is a hoarse voice, and the treatment like in keratosis laryngis, we will do a stripping or the decortication and followed by voice rest and the speech therapy. Now the next condition is the atrophic laryngitis or laryngitis sicca. It is the basically extension of atrophic rhinitis what we have seen in the nose, and it is caused by the Klebsiella ozanea. The clinical feature of this is patient presents with hoarse voice and there will be a dry irritating cough. On indirect laryngoscopy, we will see two things, that there is a atrophy of the laryngeal mucosa and there will be excessive crusting. Like in atrophic rhinitis also we see a lot of crusting. So here also in laryngitis sicca also we will see excessive crusting. The management part is that it consists of laryngeal spray containing glucose in glycerin, and we will be giving a antibiotic to this patient. So just to revise, atrophic laryngitis or laryngitis sicca, it is basically the extension of the atrophic rhinitis and it is caused by Klebsiella ozanea. The clinical features, it includes the dry irritating cough and the hoarse voice. On indirect laryngoscopy, we will see atrophy of the laryngeal mucosa and we will see a lot of crusting, and management part is the laryngeal spray which contains glucose and glycerin along with antibiotics.